For anyone with early detected breast cancer of small size, we can do what we call breast conserving surgery. The rest of the uninvolved breast is not removed, and only the area of tumor together with a rim of healthy tissue is removed. Reconstruction can also be done with or without mastectomy. So if you choose to remove your entire breast, you may be able to undergo immediate reconstruction, which is a reconstruction that is done at the same time as the removal of your breast, or it may be done at a later stage, especially if your tumor is slightly more advanced and you will need radiation therapy as well as chemotherapy. And sometimes patients are just already so overwhelmed with the diagnosis of cancer that they cannot think of beautifying themselves. Cryoablation is also something I want to touch briefly on later because it is an up-and-coming new technique with a very promising short-term result. So there's some diagram to show you. If you go for a lumpectomy, you will have a cavity that is a defect within your breast, but the rest of the uninvolved breast remains intact. If you go for a mastectomy, the entire skin paddle together with your nipple is removed, and at the end, you'll be left with a straight scar. If you go for reconstruction, there are several ways we can do reconstruction. We can use an implant directly inserting into the breast, or we can take multiple other normal tissues elsewhere, such as in the gluteus, the back muscles, the abdomen, and even the thigh to reconstruct the volume and the shape of your breast. Lipofilling or fat grafting has also been proven to be a useful adjunct to someone like this. Frequently in the past, a patient had undergone mastectomy and radiation therapy to the chest. The skin is scarred down, the muscles underlying it is fibrosed. It is impossible for us to do an implant reconstruction for this patient. But given her small size, she doesn't have a big belly for us to take the fat from there. What can we do then to make her eligible for an implant? We can do liposuction of the desired area, and we harvest the fat into the breast. This is the appearance after one episode. You can see the bulge of the skin now because the fat has integrated into her own chest. And that makes the quality of the skin much more supple for us to be able to put an implant thereafter. And these are some of the successful cases that we did when we were in Thailand. When we talk about breast cancer surgery, we don't just limit surgeries to the breast. We must also check the armpit, or what we say here, the axilla. And how we localize the lymph nodes in the axilla is important. One of the ways is to inject a blue dye, so that the blue dye will travel through the lymphatic channels into the first group of nodes that the cancer cells would have spread or affected. Then we remove that tissue for testing and see if it's been found to have presence of cancers within. If you have a lumpectomy, you can still have a separate incision in the armpit for us to check that. And so in the end, you will end up with 2 scars on the breast. If you choose to go for mastectomy, there will only be 1 scar. Cryoablation is not a new technique. It's already been approved for use in multiple other kinds of cancers, especially kidney, bone, as well as liver. The technology has been around for over 20 years, but its use for the breast is still quite limited. What it is basically freezing the tumor using extreme cold temperature. And with this demonstration, we're using liquid nitrogen, but you can also utilize argon gas. It's the same type of probe that we use when we do a biopsy that we showed you earlier on. It's called a vacuum biopsy. But this probe is called cryoprobe, and it's special because at the tip of the probe, in the middle here, it has an apparatus that is connected to the outside port that liquid nitrogen can pass through. Once that liquid nitrogen passes through, it induces an ice ball phenomenon. And literally, an ice ball will be formed that will engulf that tumor, and then that's the way the cancer is killed. Firstly, we use an extreme cold temperature of minus 170 degrees Celsius, and no living tissues can really withstand that. The mechanical formation of the ice alone will break your cells apart, and subsequently, when you thaw it, when the ice becomes water once again, the fluid that rushes out of the cells will rush back into the cell, balloon it, and also burst it. You can see some blood vessels here as well. It does not just destroy the tissues, but also causes a thrombosis or a clotting effect in those blood vessels. So in the subsequent next days, the tissues is deprived of any oxygen because the blood flow cannot flow to that region. Once that is done, the probe is removed. We don't stitch the skin. You'll go home with a little string. What do you expect? If you are doing this procedure when you're fully awake, you will feel that it is cold, and you will feel that there is obvious swelling occurring inside your body. The whole procedure, although the internet says 30 minutes, in our experience is about 1 to 2 hours from start to finish. It is usually done as a day procedure, with or without sedation. Currently, for the breast, cryoablation is approved for treatment of fibroadenoma, which is a benign breast lump. But at the same time, several other centers in the world have already done for early breast cancers of a specific type, those type of cancers that are responsive to your hormones. In Japan, Professor Fukuma has already done 400 cases over the past 10 years, and his recurrence result is similar to that of excision. It's less than 1% in 5 years. So really good short-term data, and now multi-center studies in the US are doing that because they are trying to address the safety and efficacy in long term. Breast cancer treatment has come a long, long way. And you can see this lady here. She was young when she had breast cancer, and now she's pregnant. People may say she's crazy, but it is possible now. So for young ladies who are affected with breast cancer, knowing that we have very effective treatment if you come forward early, and if you desire in the future that when you're done with your cancer treatment, you might want to start your family, there are several ways we can preserve your ability to get pregnant later. But I won't get into too much details there, but it is possible. So all in all, how do we beat cancer? Number one, you need to know the risk. Not only do you need to know about your history, and even if you don't have history or any risk factors, remember that breast cancer does not discriminate. Early detection is really our best defense here because it saves the breasts, it can save lives. There are multiple options of treatment available, as you can see. There's reconstruction with mastectomy, there's breast-conserving surgery. There's even possibility for cryoablation. The odds of successful treatments are the greatest when it's detected very early on, and you can really look forward to being cancer-free again. Point number two, you need to be breast aware. So I took this slide because it raises the importance of you raising your arm and really looking in the mirror because you don't want to miss anything in the lower pole, like a little dent or a redness or a swelling there. And if you notice any changes, please seek attention. Schedule your mammogram, especially if you are at average risk of breast cancer at the age of 40. And know that if you are diagnosed with one, it can be treated. You should adopt a healthy lifestyle choices, as we mentioned. We're talking about cancer the whole afternoon today. So eat healthy, exercise regularly, get to, and maintain a healthy weight. Avoid alcohol and smoking, if you ask me, and not take one or the other. And if possible, you can try to choose breastfeeding and avoid birth control pills or hormone replacement therapy. Thank you.